One.
But today we have Dr. Akshay Kriplani, and with him we have Dr. Shruti Pandit Kriplani. Today we're going to be talking about BPH and OAB altogether, because these problems are very pertinent actually, and there are patients who want to know about these particular topics. So we have the doctors in house already. So we're going to be starting from you, okay? For the patients who don't know what this BPH is, because it's a new thing that there are a lot of patients are hearing of, because there are people who think it's a matter of age, and it just comes with the age, and there is nothing we can control about it. So would you like to tell our patients what it is and how we can control it?
So yeah, hi everyone, and we both are urologists. And see, BPH means benign prostatic hyperplasia. So before you know what is benign prostatic hyperplasia, big words. See, every male or men in general have a gland under the urinary bladder. So we have a urinary bladder, and there is a gland just below it. It's called the prostate gland. This prostate gland is necessary for reproduction. So basically, the sperm production, the prostate gland provides nourishment to the sperm. With time, over age, and on an average, it's said like over 50 years, this prostate gland starts to enlarge in size. Reason being some hormonal changes. It's a little, will not go into the hormonal changes, but because of this enlargement, it creates an obstruction in the way of the urine. That is the urethra. So urethra, which is attached to the urinary bladder, is obstructed because of this enlarged prostate gland. This is called benign prostatic hyperplasia. It is extremely common in our population. It is known that about 60% patients of 60 years will have benign prostatic hyperplasia in their lifetime. 70% of population will have by the age of 70 years, and 80% in 80 years, and 90%, and so on. It is that common. So this is benign prostatic hyperplasia, enlargement of prostate with age causing urinary issues. What urinary issues? Because of the obstruction, there is a lot of urine which is collected in the bladder. So it causes poor stream of your urine. You have to go urine quite frequently. When you have the urge, you need to pass urine as soon as possible, otherwise it might leak. Sometimes the prostate gland is so big that it causes retention of urine. You can't pass urine. This also causes urinary infection sometimes, and in late stages it can even cause damage to the kidneys.
Well, when we are talking about infections, and we have a lady doctor as well with us, I would be very grateful to you if you could just put some light on UTI, because we have female patients as well, and they always look for some suggestions or what UTI means and how we can tackle about it.
Hello everyone, I'm Dr. Shruti. Now what we have to understand is that UTI or urine infection,
Yes,
is a common term which it is common both in men and
Yeah.
in women.
Yeah.
There are separate causes, but it is more common in women.
Yeah.
What we assume is that after menopause, after the age of 40 or 50, many women, even younger women, it's very common to have UTI. I have a problem of UTI, I have a problem of UTI. That's what patients do come to us. But what you have to realize is UTI infection is a manifestation of some other disease which is happening in your bladder or your urethra or the pipe or your kidneys or something like that. And when you come to us as a urologist, our job is to find out what is causing the UTI. UTI, it's not that you will be on long-term antibiotics for a long time. That is not the treatment. That is just to control your symptoms. We have to really find what is the cause. UTI is just a manifestation of some other disease which is going on inside the body. There are several ways we have to look for what is the cause and why this is happening. So it is better to find the cause and treat that rather than just keep yourself on antibiotics which have adverse effects later in life.
Well, there are ladies, what they do is they have the UTI for 2 days, 3 days, only 2-3 days, and they think it was just like came and gone. There is nothing about it. So do they need to be concerned about these sort of UTIs which are very long intervaled? I mean, it happens 2-3 days, and then 2 years, after 2 years we have again 2-3 days. So is it a matter of concern, or it's just like that?
UTI should not happen in anybody.
Okay.
If it is happening, there is a reason for it.
Alright.
The reason can be very varied. It can range from anything, even a stone in your kidney, an alteration in your diet, or alteration in the water intake, some hormonal changes. So there are many multitude of causes which can cause UTI. Some sort of burning which happens once or twice, it's not something you just let it go, because even something like a stone can cause it. So at least a basic evaluation is required for every patient who has UTI, of why that UTI has happened. We need to do a basic urine evaluation, a basic ultrasound, and we have to make sure this does not happen repeatedly. Of course, we won't know that, whether it's going to happen again, it's not going to happen again. That we'll know only once we find out why it is happening.
Right, true. Actually, coming to your topic, which is BPH, when there is a patient who is delaying the process of getting to a doctor, and he's thinking that I'll go, and he's not coming. So what are basically, why it has become so important for this condition to be diagnosed at an early stage and not delaying the process?
Yeah, so like I said, this is not very uncommon in our population.
Yes.
Everybody in India is a working man, most of us. Small symptoms are overlooked by Indian population. So this scenario is extremely common.
Yeah.
It's only the late stages where most patients come to the hospitals, and because of the benign prostatic hyperplasia per se, there is so much urine in the bladder which is not being able to come out. The bladder has a lot of changes, which means the urinary bladder is trying to push the urine against resistance. So it might cause it to get weakened.
Oh.
Which in simple terms is called as bladder failure.
Alright.
So you can lose an organ because of not being able to be treated early. Similarly, because of this weakened bladder, the pressure in the bladder becomes so high that the kidneys, which eventually drain into the bladder, can also get into failure. So these are rare events of kidney failures in prostate, but it's not impossible, and it happens. We see patients on regular basis where it happens because of prostate issues.
Well, when is the time when the surgical interventions is necessary, and is there any possibility that we can avoid it?
Yeah, so also coming to the last point, because of the obstruction, the urine gets infected, you have a lot of stone formations in the bladder. So when you have patients with stones in the bladder because of prostate, that is the first indication to get operated for the stone obviously, and also for the prostate. Now, if a general patient of benign prostatic hyperplasia, BPH, comes to you, you first manage it medically. So a 3-month medical course for the condition gives a lot of relief to the patient. But patients who do not get relief with this medical management or have relapses, or second point I told about the stones, or bladder getting weakened, something called as diverticula is outpouching in the bladders because of the high pressure. These patients with upper tract changes, that is having issues with the kidneys because of the bladder and the prostate, these are all candidates for surgery. And prostate surgery is not something in today's world that it's a very a glorious surgery where there's a huge cut or a big surgery. It's considered as a major surgery, but it's all endoscopic and with lasers and heat energy.
What is the recovery time when we're talking about this sort of surgery?
So if the patient is operated today,
yeah,
I think day after tomorrow morning he is free to go home.
So it's
that
easy.
Yeah.
Well, thank you so much for being on board with us.
Thank you.
Thank you.
Thank you.